holistic methods of nutrition and healthcare for all your pet's needs. Next on Living Smart.
Good girl.
Hello, I'm Patricia Gras. Welcome to Living Smart. Today's guest, Dr. Happy Babbish, shares her unique experience as the vet of last resort for pet owners who have tried everything else. At the end of her life, Hannah has some communicating to do. Her owner, Renee, wants to know if it's time to let go.
Hannah's old, and I just want to know if she is so uncomfortable that she actually is ready for us to put her to sleep.
Both owner and pet have come to animal communicator Myra Logan to find out.
Just from what I can feel, I don't know that you'd want to put her through this much longer.
The idea of using a communicator comes from Dr. Happy Babbish, a pioneer in the field of holistic veterinary medicine.
I think it's so important to find out really what the animal's wishes are. You know, we get in cases, and we don't always have a whole lot of time with them, where they have obscure problems, and sometimes it can be very helpful.
Dr. Babbish has spent the past 20 years using acupuncture, kinesiology, and chiropractic care to complement the traditional medical care she gives to her patients.
I am a little bit the prophet to spread the word because these people haven't even heard of these things. Good girl. How's Dixie Van, Miss Anderson?
Dixie likes to strut her stuff. A glamour girl, she models. But recently, she had to stop.
She likes to show off, and so for her to have weepy, moist, bleeding lesions all over her face and her legs and her abdomen and all that was just horrifying to her and to her owner.
Using traditional Western treatment didn't work, so as a last resort, the owner brought her to Dr. Babbish.
She just was in really bad shape. Her immune system was down, her hair was falling out. And she started getting acupuncture treatments, and it's been success ever since.
Dr. Babbish offers customized care. Francie Lou was paralyzed after a back surgery, so she referred her to Mrs. Miller of Dogs to Go.
Just because a dog is paralyzed, you know, they don't need to be put down. They can get along just fine.
Actually, we just finished it.
The goal is to do whatever it takes to comfort her patients. Large animal vets couldn't figure out what was happening to this sick mule.
We did a little bit of applied kinesiology, and we asked a few questions, and the results that we got were that it was involving the bladder, and she actually did some acupuncture points on that area, and I did also get some antibiotics.
The mule healed in just a few days.
I think a lot of people are not open-minded enough to accept that there's another way to medicate and treat animals besides just routine Western medicine. And I think that they do better with a more natural, holistic treatment.
Dr. Happy Babbish, thank you so much for joining us.
Thank you for having me, Patty.
I'd like to know why in your career you decided at one point, I don't know enough, I need to know more, and you started studying, Chinese traditional medicine, kinesiology, all the different modalities that we see in the story.
I was in a serious car accident years ago, and what I found is that Western medicine doesn't treat pain or degenerative disease disorders.
Right, chronic diseases and stuff like that. Yeah.
As well as I wish they had. So I ended up having to look up things on my own. And on myself, I used vitamin therapy and whole food nutrition, acupuncture, chiropractic, a form of Asian healing medicine, Yang Shu Yang medicine. I tried all these modalities, and look at me now. I'm pretty much pain-free all the time. I'm on no medication. I'm happy almost all the time. It's just been a godsend to me. And I thought, if I can do this on me, just look what I could do for people's
for
pets.
animals as well. You also had a life-changing spiritual experience. Tell me about that.
Yes, I was in a very violent carjacking, and I tried the regular route of regular therapy, and I still was left with a lot of fear. And so a friend of mine sent me to a Chinese doctor who was able to get rid of all the fear. So now all I remember from that episode is I remember every detail, but I just remember the awesomeness of the angels that came to help me during that horrible experience. And I remember I was privileged to knowledge and visions of things, and it taught me that I was granted the ability to have another chance in life, and that I really need to make a difference in this world. And so I hope to make it a better world for pets and for their people too.
And I'm sure you're doing that. Now, what are some of your practice philosophies?
I remember all too well when I went in with a chronic disorder that I didn't fit real neatly in a typical 15-minute doctor's visit, and people didn't always believe that I had a problem. I wasn't disfigured, and so it was very, very difficult. So it helped me. All this experience helped me to know when people come to see me how important their animals are to them, how their whole lives revolve around their animal and their animal's happiness. And I'm often not the first or second opinion. I'm often the third or the fourth. And these people are as desperate for help as I was looking for help for me. And so I try to hold that very dear to my heart. And I try to treat every patient with kindness and respect, and to treat them as if they were my own pet.
And you love your pets, I know that much. How do you respond to people who are not open to holistic vet medicine?
People come to me, some are just referred right there for holistic, so they're easy to convince. But a lot of people come in and they just want Western treatment. And I always try to at least give them all the different viewpoints available. Luckily, I have studied both Western medicine and holistic medicine, so I can offer them both, but I go along with what their choices are. Unfortunately, a lot of people do wait until we're desperate and dying before they try anything alternative. But some of the times I can bounce those animals back, and it always just amazes me, and it makes me so happy to see the animal get well. And then what I find very funny is later I run into the owners, or I get a letter back from the owners telling me that now they're doing holistic care on themselves.
That's great. Now, what are some of the most common problems you treat with, for example, traditional Chinese medicine?
That would be acupuncture and herbology, and really you treat just about everything. But the things that come in most to see me are seizure disorders, certainly a lot of bone and joint arthritic problems, a lot of back pain problems, but people don't understand that I work really well with kidney failure, liver failure, even diabetes. There's just everything is treated. Eye problems are treated well with traditional Chinese medicine also.
And chiropractic care?
Chiropractic care is, a lot of people wait for chiropractic care even for themselves until they hurt. Ideally, you would do chiropractic care to prevent you from ever getting to the point of hurting. You want to keep the spine aligned. The spine is in charge of everything. People think it's just about bones and joints or the spine, but it also involves even all your internal organs, because your spinal nerves feed your kidneys, your colon, etc. So a cat that has a constipation problem called megacolon actually may have a problem in its lower back, or a dog with actually a knee problem may actually have a lower back problem also, because the nerves are feeding the muscles that are creating the stability or lack of stability now around that knee.
Kinesiology, we see that as well that you do.
Kinesiology, I'm actually being taught it through a neurosurgeon, so it's got some real serious medical basis to it.
Let's explain what it is first. Yeah.
I call it energy testing, and I'll use it to tell whether or not a particular therapy would be in the animal's best interest to get a negative or a positive result from that, or also which herb to use, or which vitamin to use, or what to pick.
How does it work? Because I know you hold the owner's arm, right, and you have the owner hold the pet. How does it work?
It's I'm actually not. I'm using the owner just as to transfer through the pet because I can't get the pet to hold its paw for me.
Right.
And the way I ask the questions to God, that whether or not this practice or this antibiotic would be in this pet's best interest. You know, when an animal comes in and seriously needs an antibiotic, it's a life and death situation. Even if I run a culture sensitivity, which is the best medicine to do, I have 3-day wait time before I get the results. This helps me to make a decision right then and there, and I'm just amazed at how it'll correlate with the culture sensitivity results.
And it's pretty accurate for you.
Nothing is 100%,
well, of course,
but it really helps me to be convinced that that particular medicine or that particular modality is what I need to use on this pet at that particular time, and it does no harm.
That's great. And is that the same as using energy therapy?
Energy therapy is different, and I do a form of energy therapy which just helps to expedite the healing process.
Very common problem in animals, especially in Houston. Allergies. What to do?
Allergies run the whole gamut. Allergies can be simple to work with, or they can be very complex. The most complex is going to be more the inhalant allergies, which is called atopy. And sometimes I work with just about everything when I'm dealing with allergies. Nutrition is a big thing. One thing that's interesting about nutrition is we've always been taught to just feed the same food all the time. But in animals and nature, there's total variety. So I may try changing the protein source, or I may try multiple protein sources. In nature, we see very few allergies because the geese are here for a few months and they eat geese, and then they're gone. Unfortunately, the baby rabbits are prey at this time, and then they grow up and they're hard to catch. The seasons change, the vegetation changes, everything changes. So I'm into variety in foods. But the allergies are tough ones, and I use everything that I have at hand. And when I use acupuncture, herbology, even chiropractic can be helpful for that. But sometimes you have to periodically fall back on Western medicine, too.
That's right. You work with an intuitive consultant or an animal communicator. Why did you choose to do that?
A long time ago when I was a new graduate, I remember veterinarians talking about certain very difficult health cases being solved through animal communicators, and that intrigued me. And I was lucky enough to date a horse whisperer way before people knew what that was. And so I really began to believe it. And then later I took a class in it, and then I found out that anyone can do it, and I can do it too. But now I use a very talented animal communicator, Myra Logan, to do my cases.
How do you know the communicator's not making it up?
The facts that she gets are so specific
to that animal,
that owner, that home, that it's very convincing.
Do you have any examples?
One story would be a woman brought a little rescue Boston Terrier to me, and she was desperate for answers because this little dog was just creating havoc in the household. She had a whole household of adopted pets, and I asked her, I recommended that she have a session with Myra Logan, and I said, you can just do it over the telephone. Well, she was very skeptical over that. But she did take my advice because, once again, she was very desperate. And they had, and the reading brought out. And the woman said that even during the reading over the phone, the little dog got very quiet. All the animals got very quiet and listened, which was very unusual. And so she noticed that. And she found out that the dog was actually acting out because it thought that it had been in several foster homes, that the only way it liked this home, it wanted to stay in this home, but the only way to stay in this house would be to act like the boss. And Myra had to explain to her that was the exact wrong thing to do because she might have to find a new home for her because she'd just ruin the ambiance of the whole household.
Right.
And the dog changed from that moment on.
One of the problems that we hear about all the time is hyperactive dogs or dogs that just don't behave, they misbehave. How do you deal with that? Do you usually use the animal communicator or anxiety in animals? How do you deal with that?
Well, those are several different topics. However, I think one of the main things we seem to be missing with dogs is that we're not training them. And so I think training is the basis of all of this. And by training, you're going to have a lot less behavioral problems. You're going to have a much happier household. It's going to make life so much easier for you, for me as a veterinarian, for the dog. The dog does like to know where it stands in the household, just like with a parent-child relationship.
Right. They want the discipline. They need the discipline.
They have to have the boundaries.
Nutrition, that's a major topic for you. You work very hard on that with your clients.
Yes, nutrition is one of my favorite things, and I have a lifetime of learning yet to come. I find it probably interesting or amusing that if I was to tell you that I had this special diet that came in this dry kibble food and came in a bag, and that's all you needed was water and love with that, and you could live on it, you would laugh at me and you would go find another doctor. Yes. And so I believe that you know that you can't, it's not good for you to not have good fresh food in your diet. And so I believe that too with the animals, and that's how I try to counsel people.
So raw food.
I am an advocate. What do I do with my own pets? I feed raw, natural diets to them. I think that it's kind of amusing, too, that people never took a class on nutrition for themselves or for their own families, and yet they're afraid to try to cook or home prepare for their own animals. I do think there are guidelines that need to be followed. There's great books out there. There's great stores with people running them who know all about nutrition, and yet there are particular health problems that I would maybe not change to that. So I do think that if you're going to switch over, to team up with a veterinarian who can help you, and a veterinarian who's very familiar with these diets and open to these diets before you start.
Give me an example of what you feed your cat, because you have cats at home.
Yes, actually, cat nutrition has really changed a lot, and cats should not be fed dry food. They're actually desert creatures, and the dry food overly dehydrates out an already dehydrated animal. And so it sets us up for urinary tract problems, infections in the bladder. It sets you up for renal failure, which is kidney failure too. Also, most of the foods that are on the market have way too much carbohydrate. And the schools are now changing their lectures, so that is going to put pressure on, and I'm beginning to see the commercial animal foods beginning to change also. Cats for a living, they finally decided they are true carnivores. This is different from a dog. A dog and a person are an omnivore. A cat is a carnivore. Their whole system is different. It is shorter in the cats so that they can eat meat. Cats eat mice for a living. And so the actual correct foods should follow the constituents of what a mouse would be if you broke it into parts. How much protein, how much fat, how much bone, and then also the vegetation would be the stomach contents in the mouse. And so but we're quite lacking in the commercial foods at this time to come up with diets like that. The diets that are on the market right now, with the high carbohydrate, a typical cat food is 45 to 65% carbohydrate, where a cat has no carbohydrate requirement whatsoever. So these foods actually tend to lead to obesity and even diabetes, irritable bowel syndrome, and all kinds of allergies. Diseases. Yes.
Your personal feelings about vaccines.
That's a very controversial subject right now, and some of the ideas are changing all the time. I personally think that we do over-vaccinate. I think that vaccines do a lot of good, but they also can do a lot of harm. And the vaccines do last, some of the vaccines last a lot longer than we were originally told, and studies are beginning to prove that. And I think owners actually have to review some of the alternative literature out there, because they need to join in and help to make some of these decisions also on the vaccine schedule for their pets.
Looking back at your career, what are some of the great success stories?
Probably the alternative medicine ones, of course, are the most thrilling, because they're a whole additional thing that I'm able to offer and see, and surprises me all the time. There's always that case, that paralyzed dog that's carried into me. I do acupuncture, and it truly walks out on its own. I mean, wow, wow.
Right, that's neat.
Or the little dog that comes in that's in a lot of pain and is possibly referred for diagnosis of vertebral disc problems or for spinal meningitis, and I actually find it's a subluxation of a vertebrae.
Wow.
I
So
adjust it, and they walk out prancing, happy, and pain-free. Wow.
So you run into a lot of misdiagnosis as well, I guess, like every doctor.
Oh, I think that medicine is just so complicated. I hate to call it a misdiagnosis. And also, I think that the courses that I've taken, ideally, they would be required in veterinary school, but there's just too much they already have to learn. And I hope more and more people take these classes because they're so open your mind, and they teach you to look for things we never were taught were there.
Interesting. The most common mistakes people make about their pets?
I would probably go once again with the dogs, that they love them, and therefore that they are afraid if they train them that they won't love them as much. And it's actually the opposite. Your pet will love you more with the training. Slipping over to cats, I think I'm such a cat advocate, and I see way too much declawing of cats. So many clients come to me just to declaw their cat, and they've never asked anybody about it. They just think it's something that you do, and it's not. Cats are trainable. They're not trainable in the same way dogs are, but they are trainable, and they can be trained to use scratching posts. They don't have to have their fingers cut off. And actually, declawing a cat is not just taking the nails off, it's actually cutting off at the first knuckle all of their feet. And you can only imagine the pain that would cause you, but then they have to walk on those also. Some cats will actually be in pain the rest of their lives. So I want to at least have a discussion, and I at least want people to really try other avenues before they would go to that sort of a drastic
you talk them
surgery.
Out of it. The hardest part of your job and the most satisfying?
The hardest part for me is how much I worry. Once again, I believe that these pets, I look at them as though they're my own pets, and I understand the owners think of them just the same way as I look at my own animals. And so I worry all the time. I worry about my cases tomorrow. I call in to find out who's coming in and what the cases are. I study and I review. I worry every time I do a surgery. I don't sleep good that night. I just worry all the time. So it's tough because I guess it's tough because I care so much. And I'm so afraid to make a mistake. I'm so afraid if something dies in my arms. The most satisfying is that, especially with alternative medicine, I really get a bond with my clientele. And we often share stories and philosophies with each other. And plus, I get to share all the alternative medicine. And so often, people tell me later, or they'll send me a beautiful card to tell me that I truly changed their life.
That makes a big difference. Have you ever had a situation where you're afraid because you have a big animal, they're sick? I mean, I was next to you when you were treating a horse, and I was thinking, what if this horse decides to kick you? How do you handle those situations?
It's really part of the job, and it entails a lot of your experience, but you do get into bad situations, and bad things can happen. I was bitten in the hand by a precious dog, a precious, sick, dying dog, but I was out for a month, and my hand swelled up the side of a baseball mitt, and it was pretty frightening. It could have ended my whole career. So certainly you're always cautious, and some animals you just you can't treat. With my treatments, especially alternative medicine, I do have to generate a lot of love to send to the pet, and it's very tough to do that if I'm afraid.
One last question: how do you know you are leaving smart?
You know, inside all of us, we have a little voice, and it always lets you know what is right and what is wrong. And I believe if you follow that advice, you will have a good life. I followed that voice, and I became a veterinarian. I continued to follow it, and I became an alternative medicine veterinarian. You had that voice, and you followed it to television and now to your own talk show. And that voice will help us, I believe, to change the world in a better way, and it's made us who we are. So you only get one body, And we want to take care of that, and we want to listen to that voice.
Now, you're a perpetual student. Do you plan to study any more stuff?
Of
or is
course.
it ever going to end?
Of course, Patty.
So you'll keep going?
I'm in, yes.
What's in your future?
I'm in the midst of Chinese herbology and advanced Chinese medical theory, internal medicine, and then my next is homeopathy, and then I think I'll actually take a little bit of a break.
It'll never end. Thank you, Dr. Habby Babbish.
Thank you so much for having me, Patty.
And you can reach Dr. Babbish by calling 713-906-0361 or on the web, myralogan.com. If you'd like more information on holistic vets, you can visit naturalhealing.com or the Veterinary Institute of Integrative Medicine at www.viim.com. Please remember to visit houstonpbs.org/livingsmart for a complete resource list, and feel free to share your pet care tips so we can post them on our website. You can also call us with your comments at 713-743-8513 or write to us at livingsmart@houstonpbs.org. I'm Patricia Gras. That's our show for today. We hope you've enjoyed it and that you'll remember to live smart. Have a great week.